Range of motion therapy in ALS. These movements will all be passive, meaning that all movements are done by the caregiver and the patient is relaxed. Perform 10 repetitions, such as 10 bendings and 10 straightenings on each joint. Stretches are to be held for 10 to 20 seconds for each position. Bend or straighten each joint to the point of firm resistance, just prior to discomfort. Decrease the amount of motion if pain is encountered. Good communication is crucial. Let your caregiver know if you need more or less motion. Your caregiver should watch your face for signs of discomfort to decrease motion. The main goal of range of motion therapy is to improve comfort and relieve pain. This video was shot on a massage table for ease of demonstration, but the therapy is typically performed while the patient is lying in bed. Caregivers should consider applying lotion to your hands and feet so that it is easier to milk these areas to push the fluid out. Milking the feet and legs. Milk the toes and feet, pushing the fluid from the tip of the toes down toward the ankle and up into the calf. Range of motion, toes. Wiggle the toes. This can be done 2 at a time in opposite directions or individually. Stretching the foot. Push just the toes back toward the face and hold for 10 to 20 seconds. Bend and hold the ankle for 10 to 20 seconds, pushing only on the ball of the foot to stretch the calf. Range of motion, ankle. Make circular motions with the foot and reverse. Bend and straighten the ankle. Range of motion, legs. Using a bicycle movement, bend and straighten the leg. Stretching the hips. Supporting the leg with your hand below the knee, bend the knee toward the chest. Be sure not to push on the foot or ankle. Hold for 10 to 20 seconds. Bend the knee and cross over. Bend the knee and bring out to the side. Hamstring stretch. Straighten the leg and slowly lift toward the ceiling. Watch the patient's face to know when to stop. Slowly swing the straightened leg out toward the side, watching the patient's face. Massage the hamstring if the muscle cramps. With a straight leg, slowly cross over, watching the patient's face. Range of motion, hips. Use big circles while bending and straightening the leg. Reverse directions. Milking the hands and forearm. Start with some lotion to make it easier to milk the hand. Place pressure and gently squeeze or milk the fingers, working from the tips of your fingers toward your knuckles and down toward the elbow. Range of motion, fingers. Bend and straighten the entire length of the fingers, 1 finger at a time. Start with a little and increase. Range of motion, knuckles. Now bend and straighten the joint where the knuckles are. Start with a little and increase as you go. Stretching the hand. Make a fist and squeeze. Hold for 10 to 20 seconds. You should feel the stretch on the back of your hand. Range of motion, wrist. Bend the wrist forward and backward. Move the wrist in a circle in both directions. Range of motion, elbow. Bend and straighten the arm at the elbow, supporting beneath the elbow. Move the forearm around in circles, keeping the elbow in the same place, and reverse. Range of motion, shoulder. Bring the arm straight up toward the ear, support at the elbow. If necessary, the elbow may be bent at the top of the stretch. Bend the elbow and reach back behind the head. Hold for 10 to 20 seconds. Move the entire arm around in big circles, both directions. Bend the elbow to 90 degrees and swing out toward the side. Hold for 10 to 20 seconds. Shoulder massage. If the patient has shoulder cramping, pull the arm straight down and massage the outside of the shoulder. Range of motion therapy is one of the best medicines available in treating ALS, but it is currently underutilized. This therapy provides symptomatic relief of muscle and joint pain or discomfort. It helps nourish the joints and keeps the muscles and joints flexible. The benefits of caring touch can be felt not only physically, but emotionally as well. Participating in therapy provides a quiet time of peace and potential normalcy for the patient during the day. In pre-bedtime therapy, it can be used to relax the muscles and prepare the patient to fall asleep more quickly and comfortably.